So let's review some of the things that we've learned about the posterior shoulder. First of all, let's outline the scapula. Here you can see the medial border, inferior angle, out lateral side to the glenoid, then back up the spine, and then to the superior angle right in this area here. To really get a look at that, we'll have to reflect trapezius, which is attaching to the spine, up and out of the way. And we can zoom right in here to see that a little bit. Now what we can see coming off the medial border muscles will be the levator scapula off the superior angle, rhomboid minor towards the root of the spine of the scapula, rhomboid major coming off. We've already talked about those, so let's reflect them out of the way and under. There we go. And we're also going to pull off this muscle right here, which is our latissimus dorsi, heading out laterally towards the humerus. Now we can clearly see the medial border muscles. Indeed, we can see right in here, if we push that scapula out a little bit, we'll be able to see all of this muscle in this area here, which is all serratus anterior. There's the edge of it, and now we're going to pull it back against the thoracic cage, which is its job, and you can see how it's working anteriorly in here to get to the ribs. Now we want to talk about these posterior shoulder muscles that we've seen, so we're going to pan up a little bit more. Inferior angle again, chromium process. We've got the posterior deltoid fibers coming off of the spine of the scapula in this area. We're going to reflect those out laterally. Now you can see the axillary nerve and the posterior humeral circumflex artery coming through the quadrangular space. We can see here the long head of triceps muscle coming up, and now off the lateral border we can see things like Teres Minor, infraspinatus, and of course down in this area Teres Major. What are these innervated by? Well, we have the supraspinatus and the infraspinatus, which are innervated by the suprascapular nerve, artery, and vein, and we'll see if we can swing a shot of that in. We're going to try to get right up in behind that trapezius. So now we can see the ear up in this area. We're going to reflect the supraspinatus up out of the way, and then we're going to zoom right into this area above the supraspinatus to see the neurovascular bundle of the suprascapular nerve, artery, and vein. Here we can see the nerve right in here, and notice how the nerve is going under this transverse scapular ligament, navy under, and then we have the artery and the vein, which are going over top of that ligament, and that's army over. Suprascapular artery and vein over the ligament, suprascapular nerve under the ligament. That will supply the supraspinatus and the infraspinatus muscles. Now we're going to flip the cadaver around so that we can get a really good view at the suprascapular structures. Just for orientation purposes, we have the ear, the shoulder coming down and around where the deltoid is. We're going to reflect this skin back, Mr. Big Hands. There we go. Now we can see the rest of trapezius, which will reflect up away from the spine of the scapula. We have a really good view of the medial border of the scapula right here. We have the spine of the scapula as it comes out, and there's the skin over the deltoid reflected. Now we're going to take the deltoid muscle itself and reflect it out so that we can see the, there we go, the quadrangular space, which is going to have the axillary nerve, and that's going to have the posterior humeral circumflex vessels in there as well. Remember the borders of the quadrangular space. If we go medial to that, we can see the triangular space right in here with the vessels, circumflex scapular vessels. And then if we drop down, we have the triangular interval, which is going to have the profunda brachii artery and the radial nerve. Now, as we look at the muscles of the lateral border of the scapula, we can see a nice, great big teres major muscle right there. You can see the latissimus dorsi tendons wrapping around that as you reflect the latissimus dorsi out. See a nice shiny tendon coming up in underneath and disappearing under the teres major muscle. There we can see a nice muscle coming out. That's the Teres Minor, innervated by the axillary nerve. And then we have this big beefy muscle that's making up most of the infraspinous fossa. That's the infraspinatus muscle. If we want to get above the spine of the scapula, we're looking at its partnered pair because it's innervated by the same nerve as this supraspinatus muscle right here. We'll flip that up out of the way, and we're going to zoom into this area, and you can even see right here the suprascapular nerve, artery, and vein going right into the supraspinatus muscle. And here you can see the artery and the vein coming over top of the transverse scapular ligament. And if we can wiggle that nerve a little bit. Your head's in the shot there, Mr. Big Hands. There we go. There's the nerve coming underneath this transverse scapular ligament. There we go, zooming in even a little bit more. Perfect. Look at that. Transverse scapular ligament, navy under, army over. And we'll pull back out a little bit. We have the deltoid. We have the subscapularis on the anterior surface, which we haven't seen yet. And then we have the supraspinatus, infraspinatus, teres minor, and teres major as the 6 muscles that you should have identified today. And one more muscle we're going to look at here is the serratus anterior. We'll see that in multiple views. It's attaching to the medial border of the scapula, and then it wraps around to the front aspect with serrations. And here, if I come to this side, you can see that muscle wrapping around. We still have Latissimus dorsi over here. And if I can get Mr. Big Hands to pull this border away, the medial border of the scapula, pull it right away from the thorax. And there's the pocket that muscle is going down into. I'm going to go the other way here. And now you can see some of these serrations right in through here for serratus anterior. Well, that concludes our posterior shoulder review. Hopefully you found all these things during your dissection. I'm the anatomy guy, and we'll see you next time.